skin health is the priority. In my consultation, I go for a skin check. I try to understand what's going on there. Then I talk a lot about protection, hydration of the skin, cosmeceuticals, and I give prescription drugs eventually, like retinoic acid, prescription drug to increase skin quality, collagen formation, exfoliate. Then I might go for yeah, that's it basically. And when it comes to aesthetics, then me personally, I'm a big peeler. I like to take care of, to improve skin quality by peeling the skin. Second step was relax. Does the patient do wanted or unwanted, or most of the time unwanted mimic expressions, which over time gives us marks, gives, as skin elasticity goes down, skin hydration goes down, over time, the wrinkles engrave, they stay at rest. And if this bothers the patient, doesn't necessarily mean that we need to treat all the wrinkles in the face, but if it bothers the patient, botulinum toxin type A is the medication to go to delicately, elegantly lower the intensity of shorten the amplitude of the muscle movement. Step 3 of this concept is about volume. So it's replacing volume, giving back the volume with filler injections, resorbable ones. I'm not going for any permanent fillers. Might be fat injections, but it's giving back volume where it is lacking. So it's, for example, the cheeks, the nasolabial, the pre-jowl sulcus, might be even the jawline, which loses its definition. It might be the temples. Speaking about this concept now, it's really about taking away this light absorbing transition zones. So if there's a lack of volume, the light is absorbed by these areas, and this looks not as beautiful as we consider it could be. So this is about giving back volume. And then second step was taking away volume, which is bothering, like the jowling, like the double chin. And there, my mode, how I do it, is injection lipolysis, which makes the fat cells break and being absorbed and degraded by the lymphatic system and then digested by the body's hepatic renal system, and makes the fat dissolve. And if a patient is stable in terms of body weight, these fat cells, they are dead, they don't come back. So the step 4, how I understand my concept of facial, or how to treat facial aging, is to reposition soft tissues. And as you look at a aging face, it's about again this sagging downwards and inwards, and it's basically about that the skin is like the skin. Look at the skin as a coat. It is simply too big for the underlying structures. So it shows by wrinkling, by sagging, and patients typically do this. And I say, okay, that's a facelift. I can't do that with my non-invasive procedures, but I can give your skin a prominent support by putting threads in, by treating you by threads. So these threads typically come, the 2 needles in between is the resorbable. I use the resorbable threads, and these threads carry like cones or little barbs, and they are inserted subcutaneously. So let's say you take one point at the temples, and you file it down with blunt needles ideally, and you come out where the problem zone is, the jowling, and you come up with the other thread in the other direction, and then we're pulling those threads. And as they the thread, the structure itself, hooks up to the tissue subcutaneously, you have the effect like a smoke dress. You have a lift, but you have also a push of the tissues together, which makes a better projection of, for example, the cheeks. So this is a very elegant technique. Be very careful in which threads you choose. Be careful in being well trained. You can do a harm to the patients if you're not really great in what you're doing. It's hand craftsmanship. It's a manual work which has to be trained by understanding anatomy, by going through all the trainings. I'm very convinced that you can't do a treatment like that after 1 or 2 tries. So we have and this is a really important point I would like to make. We have a huge responsibility in doing all these aesthetic procedures. My message is be safe, be conscious about what you're doing, train yourself well, and do the job as you would like to have done this job on yourself.